Good morning, viewers. We are going to talk about heart in a series of topics. Basically, let's begin with what a heart is. Okay, if you understand every body or every automobile needs an engine. So let's say that heart is an engine to the human body, without which the body wouldn't drive or do things. So heart is essentially a component of, is a composition of 4 or 5 components. Basically, it has got chambers, the upper chambers or the lower chambers, which are called the atria and the ventricle. Again, they are divided into the right atrium and the left atrium, and the right ventricle and the left ventricle. And it has got the big vessels, which are the pulmonary artery and the aorta, and also it has got the superior vena cava and the inferior vena cava. So essentially, the heart is divided to the right side and the left side. So right side of the heart basically takes in the unoxygenated blood from the body and takes it to the lungs. So these are the 2 big capacitance veins which take blood from the lower half of the body. The IVC takes blood into the heart, and from the upper half of the body, the superior vena cava takes blood into the heart. So basically, the blood comes into the right side chambers, that's the right atrium. From the right atrium, it goes to the right ventricle, and from the right ventricle, the blood goes to the lungs, to the pulmonary artery. So within the lungs, the blood gets oxygenated and comes back to the left side of the heart through the pulmonary veins, 2 on each side. So basically, it comes onto the left atrium, and from the left atrium, the blood goes into the left ventricle. From the left ventricle, the blood is directed towards the oxygenated blood is directed towards the body and all its components, basically all the organs, the skin, the brain, the liver, the kidneys, all of them receive the oxygenated blood through the aorta. So what the pulse you feel at the wrist is the pulse generated from the left ventricle, which goes from the aorta into the peripheral arteries. So basically, it is a big artery which is dividing into multiple tributaries, giving blood to the organs in the body. Apart from blood supply, the heart acts such, when you understand an ECG or the electrocardiogram, you tend to see the heart waves, the P wave, the QRS complex, and the T wave. And the traditional teaching has been the lub-dub of the heartbeat. So what the lub-dub comes from is when you have these chambers, which are the atria and the ventricles, the atria contracts and then the ventricle contracts. So the blood from the atria is pushed into the ventricles, and from there it's pushed into the big vessels, the aorta and the pulmonary artery. So basically, the lub-dub sounds come from these sides. So the electrical basis of these activity or the contractility of the heart starts in something called the electrical wires within the heart, which are called the pacemaker of the heart, which is the sinoatrial node, which is somewhere here in the junction of the superior vena cava and the right atrium. When the sinoatrial node fires, it has got certain wires within the atria which go the current goes from the sinoatrial node and goes and traverses to the atrioventricular node, which is in the septum out here, from where furthermore the electrical activity goes towards the rest of the ventricle, and the ventricle starts contracting. So there is electrical component, the mechanical, the chamber component, the blood vessels, and we have the valves inside as well. So you have some sort of gates at the junction of the right atrium and the right atrium and the right ventricle. There is something called the tricuspid valve, and then we have, when the blood goes from the right atrium into the right ventricle, it's a one-way flow. So the blood flows from the right atrium into the right ventricle, and from the right ventricle, the blood flows into the pulmonary artery towards the lungs to get oxygenated. Similarly, when the blood comes from the left atrium, the blood goes from the left atrium through into the left ventricle through a valve called the mitral valve, which is again a one-way valve. And from the left ventricle, the blood goes into the aorta. It has got another valve called the aortic valve, through which the blood goes into the rest of the organs in the body. So again, this is a one-way valve. So you have chambers, valves, electrical wires which are not seen, and the big pipes. So these are the 4 components which constitute the heart.